What was I? Something you said maybe. I just lost my thought completely. Oh, something I would like to bring up. If, for instance, you are trying to help an individual with something, but it is out of your scope of your position, how does it make you feel to be told that you can't help a patient with something, it has to be given to somebody else?
It's one of the bare basics of being a massage therapist.
Okay.
I mean, I've had people who say, "Can you diagnose me?" And I said, "I'm not a doctor. I'm not a chiropractor. It's a felony to do that. So I can't do that. I know my limitations.
Mm-hmm.
I mean, I'm firm, friendly, and professional about it." And I said, I don't have that training. I can't. I mean, it would affect my employment if I did. So, why don't you take a seat? I'll go back into the back and see if there's somebody who is qualified to talk to you. Because really, I don't think anyone wants to talk to someone who's not qualified.
Right? Well, we all use Google nowadays too, right? Everybody Googles their symptoms and they think they're dying. So.
Of course, when I Google things 3 times and I get 3 different answers.
Yeah,
so
right? Then
it's
you
like,
know it's like,
what is going on here?
I don't know about this. One other thing too, how would you handle if you were in a position that your coworker was just not pulling their weight? They just weren't doing it. You felt like you were always doing it all, carrying.
I would wait a little bit of time,
Okay.
to make sure maybe they're not, sick, pregnant, something legit, like make sure that they haven't talked to their supervisors about, something, and the supervisors are aware that they're not pulling their weight due to like a legitimate reason.
Right.
But let's say if there wasn't a legitimate known reason, I would mention to them, we need to work as a team. If one person doesn't, pull their weight, it can cause the people who do to burn out. And if that's not something that we can fix or like readjust, then I would have to go to a supervisor, because we're only as good as our weakest link.
Right.
And there's a lot of burnout in medical care. So, you have to have boundaries.
Yes.
And hold people to the standard you hold yourself.
Yeah. And how do you prefer, if you were to receive any type of criticism or corrections, how do you prefer you get that type of feedback?
I mean, I've gotten this far, being this good, winning this amount of awards, having over 150 certifications because I've been critiqued, trained, and I've learned how to be better at my job. I don't think I would have lasted 5 years if somebody didn't critique me and make me better.
Yeah. Where are you at?
What kind of person are you looking to fill the position? Obviously, someone who's punctual and knows what they're doing, but is there like a personality or someone with a specific kind of experience?
Nope. So what we're having some, I would say, troubles with kind of finding the right fit is just, it's very difficult sometimes in this position, I say, to have an expectation for your day-to-day, just because it's ever changing, like you said, the medical field.
Mm-hmm.
But there are days when it's like nonstop and you're drowning. You can't get through the day and it's very hard. Then there are the days, like you said, where maybe you have a little bit of downtime and you kind of try to fill things in.
Mm-hmm.
And the training, I feel like, is sometimes kind of hard because there's no printed book that I can say, here you go, this is the things that we're always going to do and that can help you. There are a bunch of reference guides, like I create a bunch of little QRGs and things like that. But sometimes there's scenarios and things that we may not experience in the training, the first 90 days of training and things like that. So I think it's very hard sometimes for people to not have a manual to go back to and having to kind of learn on the fly. So really someone who is adaptable and flexible, someone that is great at multitasking and being able to not take things personal, unfortunately, in this field as well. I just got yelled at today by a lady, so this morning. And just being able to kind of just go with the flow. You know, we're here to take care of our patients. We really want someone that is there to help them to the best of our abilities. Obviously, we have those limitations, and you've experienced that in the past. Like, we just sometimes can't do things for people. Even if we want to, we can't. So really just someone that's going to be able to do work, and enjoy it. And unfortunately, and I hate